that's what those premiums would cover. Doesn't this miss the point of the law to provide those who need it with insurance? Joining us is the author of Beating Obamacare, Your Handbook for Surviving the New Healthcare Law, Dr. Betsy McCaughey. Nice to see you, Doctor. Welcome.
Thank you.
What do you make of this exchange problem?
Well, in all the states, this problem is occurring because exchange plans pay doctors and hospitals much less than regular commercial health plans. So doctors and hospitals are reluctant to sign up to be part of these exchanges, and that's providing an access problem everywhere, not just in a poor state like Mississippi. For example, in California, it's reported that Cedars-Sinai, one of the most prestigious academic hospitals, refuses to participate in any of the exchange plans. So people who sign up for those plans have to drive right by Cedars-Sinai and go to a bargain basement hospital. It's happening in Maine, where hospitals and doctors in the southwest corner of the state said, no way we're going to work for so little money. So people who sign up for exchange plans there may have to drive 100 miles to see a doctor.
Wow. So basically this disenfranchises the very people the law was ostensibly designed to help, people without insurance, poor, people who don't have access to health care.
That's right. And in addition, you see in almost every state, insurance companies simply refusing to participate. And one reason is that they see a default crisis ahead. The system is coaxing young, healthy people to sign up for health insurance.
Right.
And they're going to, even after subsidies, they're going to be writing a check for $150, $200 a month.
And it needs them to make sense.
That's right. They're going to be writing that check $100, $150, $200 a month for a plan. The cheapest plan has a $5,000 deductible. So after a couple of months, they're going to say, what am I getting for this? I'd rather make a car payment. And so there's a big default crisis ahead, similar to the mortgage crisis, the college loan crisis, now the premium crisis.
You're sitting there, if viewers don't know what you're holding, that is the healthcare law, 2,400 pages that you've read, by the way, that others have not. And Nancy Pelosi said we need to pass this thing to find out what's in it. Now we know that the mandate will be delayed, the individual mandate.
No. The employer mandate.
The employer
Last
mandate.
week, Valerie Jarrett, who seems to wear the pants at the White House, made this announcement that the employer mandate would be delayed. She said it was as an accommodation to business, but business hates those surprises. Here's what it really does. It's going to drive lots of people toward the exchanges.
That's what I wanted to ask you about. Now, you're saying these are going to be problematic, these exchanges. So if it's driving all these people to those exchanges.
There are about 13.5 million people who thought they were going to get coverage on their retail job, their service job, their hotel job, and now they're not. And the reason the administration did this is they went to the NFL, they went to the NBA, they couldn't get one of these organizations to help them woo young people into these plans that really don't make a lot of sense financially for them. So now they've said, well, let's cancel the employer mandate, and all these young, healthy people who work in hotels and in restaurants and in sales jobs, well, some of them will just pay the $95 penalty the first year, but some will go to the exchange.
I should point out, since I'm not sure our viewers can see it, your copy of Obamacare is dog-eared.
Well, I've been reading it for a long time and consulting it.
You're the only one, unlike...
That's why I wrote Beating Obamacare, to help people through these landmines.
Oh, business is still trying to figure it out.
Betsy McCaughey, thank you very much. I appreciate it. Well, in Egypt, crowds expected to rage